All right, let's get started here. Hello, my name is Taryn Vielma, and I am a science educator with the Health Museum. And we're pleased to bring you the first presentation of a virtual webinar series called Conversations with Liver Experts. And this is in collaboration with the Texas Liver Foundation. So it is the Health Museum's vision to empower people to live healthier lives. And we're very, very excited to bring this series to you. And it is now my pleasure to introduce the moderator for today's panel. And this is Dr. Peace Dike.
Yes, thank you so much. And good evening, everyone. And on behalf of the Texas Liver Foundation, I would like to welcome you and thank you for joining us for our inaugural event. The Texas Liver Foundation is here to inform Texans about their liver health, liver disease, to improve the quality of life and outcomes through education and advocacy and partnership. Our monthly series are different topics that are related to different liver disease topics. Tonight, our topic will be regarding NAFLD, or fatty liver disease as it's commonly referred to. And our goal with this interactive session is to equip you with the knowledge about this disease, the prevalence, the diagnosis, and the management. We have an amazing panel of experts who are here to provide a lot of information, and I'd like to introduce them now. We have Mrs. Terry Milton. She is a motivational speaker, patient advocate, and really an ambassador for all people. She has served as a panelist and a true patient advocate in many expert forums across the country. She currently admins a large cirrhosis group on social media and is the creator of the CNU, or the Clean Nutrition University, which is also found on social media, and is highly involved in several smaller groups where she is able to share her journey and help others living with this disease. Dr. Rashmi Patel is a hepatologist, which is a physician who specializes in liver disease, and is also the CEO and medical director of the South Texas Research Institute. Dr. Patel received extensive medical and research training at various top institutions across the country, and she was an integral part of developing a research program in McAllen, Texas. Her current position at the South Texas Research Institute, acting as the co-founder and leader, is there to help identify and continue to treat patients with liver disease in the Rio Grande Valley. And then we'll have also Dr. McWhorter, who is the assistant professor in health promotion and behavioral sciences and the director of culinary nutrition for the Nourish program at the University of Texas Health Science Center here in Houston, and also the School of Public Health. He serves as a national spokesperson for the Academy of Nutrition and Dietetics and is an advisory council member for the Teaching Kitchen Collaborative. He's also a professional chef, and so he provides interprofessional nutrition education through hands-on culinary medical courses. His research includes interest in closing the divide between the culinary literacy and nutrition education and policy. So I believe this will be a great forum, and we will have the chat open. So if there's any questions that kind of come up throughout this, please leave those in the chat. We'll have a time at the end to discuss them all. And before we get started, I'd just like to express a very heartfelt and warm thank you to the Health Museum for providing this forum for us to have these conversations. Thank you, and we'll get started.
Hi, everybody. I'm Terry Milton, and I am so happy to be here today. I am a patient living with NASH cirrhosis. I also have HCC, which is primary liver cancer. So just recently found some other lesions. We're looking at the options. But more than that, my story started actually way back in 1998. I was diagnosed with fatty liver, and at the time, based upon the information the doctors had at that time, they told me not to worry about it. And so I didn't for until 2017, when during a routine surgery was found my liver was cirrhotic. the information there was not, there was not a lot of information on online for me to find out what caused it. It was NASH after the biopsy results came back. But one of the things that I found was that the information was outdated, that it didn't give all the information that was necessary. And so I started having to research and look for the best options that I possibly could to be able to live and move forward. I know that for me is that changing my lifestyle is including is healthy foods and all the things that you're going to hear about from our doctors today is so very important. I know that as a patient, as an advocate, first for myself, and then also for others that have not found that they have a voice yet, is that it's so important to go ahead and to do that research, to be a part of situations like this so that you can learn more. I'm excited that I am here today, and I'm looking forward to hearing more about what Dr. Patel and Dr. McWhorter have for us as they speak as well.
Thank you, Terry, so much for sharing your story. I think it's really empowering for patients, and it's also as a healthcare provider, it's really important to understand from the patient's perspective what it's like to have fatty liver and to be diagnosed with NASH and cirrhosis. I wanted to spend a little bit of time talking about non-alcoholic fatty liver disease and define it for you, and also show you the difference between what fatty liver looks like in different patients. So the diagnosis of non-alcoholic fatty liver disease is typically made by incidental findings. So patients may be going in for their routine physical exam, or they may be going to get some sort of imaging for another medical problem. And they come to their doctors and they say, I've been diagnosed with fatty liver. And so the first thing that I like to do with patients is to differentiate whether fatty liver is coming from more metabolic disease or if it's coming from alcohol. And so the name of the disease, non-alcoholic fatty liver disease, means that patients aren't drinking above what we call the limit, which for men is more than 3 standard drinks a day, and for women is more than 2 standard drinks a day. It's also really important to differentiate non-alcoholic fatty liver, which is defined as more than 5% fat in your liver, from a more aggressive and progressive form of the disease called NASH, which is what Terry mentioned she was diagnosed with. NASH actually stands for non-alcoholic steatohepatitis, and it's a diagnosis that we make by liver biopsy. So if you are a patient and you do get a liver biopsy, the biopsy will show not only fat in your liver, but also inflammation. And that inflammation can put a lot of stress on the liver over time. And eventually patients may develop something called fibrosis, which is also known as scarring. As Terry mentioned, she was diagnosed with cirrhosis. Cirrhosis is end-stage scarring in your liver, and she probably had the disease for several decades. Patients also ask, how common is this disease? Should I worry? And it is a very common problem. Non-alcoholic fatty liver disease affects about 25% of the population globally. And in the US, the most recent reports have shown that about 1 out of every 3 adults is affected by fatty liver. NASH is a little bit less common, but as we're learning more, we are learning that specific types of patients are really at risk. So if you have diabetes, if you have other metabolic problems that we call, like high blood pressure, high cholesterol, polycystic ovarian syndrome, low thyroid disease, or if you're carrying extra weight, it puts you at higher risk for NASH. And so what I always recommend for patients is that if you've been diagnosed with fatty liver and you have one of these risk factors, particularly diabetes, that you should be asking your healthcare provider for a little bit of further investigation. And what we do at our research institute is we see a lot of patients who have fatty liver, and if they have risk factors, we help to risk stratify them and help them to understand, is NASH a potential diagnosis for them? And do they maybe have scarring in their liver? And we do that with a point of care test called a FibroScan. You can get a FibroScan really at any specialist office, like a gastroenterologist or a liver specialist. But even some primary care doctors have this technique in their office. And it's a point of care test where it's similar to an ultrasound. It takes 10 minutes, and you can really get an assessment of fat content in your liver as well as the stiffness of your liver. So it's a great tool if you have access to it. And so there are other kind of blood-based markers that we use in medicine that can help us to stratify your risk of NASH. And it's something that is important to bring up to your doctors because there are tests available. So I'll move a little bit into just some of the treatments that are available because there aren't many. But what we do know is that lifestyle change really has a lot to do with betterment in fatty liver disease. And though we don't have any current recommendations on a particular type of diet by either the American Society or the European Society studying liver disease, we do know that if you lose about 3 to 5% of your total body weight, you can affect fatty liver. You can actually defat your liver. And if you lose 7 to 10% of your total body weight, you may actually be affecting NASH, which is really, really important. You can be affecting inflammation and even scarring in some cases. What we also like to tell patients with fatty liver and NASH is to really limit your alcohol intake. If you have NASH, you really shouldn't be drinking alcohol. It's a direct toxin to the liver. And we also like to say in your diet, try to decrease fructose enriched beverages as well. So these are things like sodas, fruit juices. You know, we really try to counsel our patients about particular steps that they can take to improve what they're eating. And, you know, coffee is actually good for your liver. So, you know, more than 2 cups you can drink of caffeinated coffee. Obviously, this is black coffee, and it does serve as an antioxidant in the liver. If you do have high blood pressure or any, you know, abnormal heart rhythm, you should definitely check with your doctor first about that recommendation. But that's kind of the gist of it. I'm sure that there are particular questions that you may have, but I'll stop talking now and let Dr. McWhorter go ahead.
Thank you, Dr. Patil and Terry. I'm really honored to be here. Definitely much different experience and expertise as the other members here. Like Dr. Dekay talked about, I'm a chef and dietitian, so a lot of my focus is on, you know, the application of diet. You know, I think anyone that's in this meeting understands that eating healthy is not always the funnest thing to do. It's not always the easiest thing to do, and it's definitely not always the most enjoyable thing. Like Dr. Patil mentioned, recommendations for, you know, the types of foods that you should consume if you're, you know, at risk of fatty liver disease or, you know, already have it are very similar to the traditional recommendations, which is, you know, a healthy dietary pattern that contains a lot of fiber-rich foods, which includes vegetables, legumes, nuts, seeds, whole grains, lean proteins, you know, a good room on your plate for those fiber-rich foods. one of the things that we see is oftentimes the average person in the USA, you know, not the average American, but the average person in the USA is very far from the norm. We know, statistically speaking, that around 90% of adults in the US are not eating the recommended amount of vegetables per day. We know that 90-something% of the grains that are being consumed on a daily basis in the US are processed grains. So they're the types of grains that have the fiber removed. So what that means is that it's absorbed a lot more quickly in your bloodstream. It's causing, you know, further problems for, you know, either there's kind of a few different problems that it creates. It overconsumption because you're hungry quicker, and then just the processing creates more inflammation, the poor quality fats, the poor quality grains, all that going into your system. So there's a few recommendations that we have as far as, you know, transitioning into eating a balanced plate, but the key thing is that behavior. You know, how do you get to there? Most of us, if you're, you know, in your middle age, 30, 40, 50, 60 years old, you've been eating a certain way for a long period of time. So it's not just an easy transition overnight. And how can you do that? And one of the things, if y'all want to put an answer in the chat box or whatever, when we think of healthy food, we often think of something like a sad salad or miserable foods or not enjoyable. You're not thinking of your most favorite delicious item. So one thing I would like to bring up today is you don't have to throw out your culture in your food. It's more about, you know, fitting in more fiber-rich foods within the foods you're already consuming. The smaller steps and shifts in behavior are going to be the most sustainable. And we could tell you, you know, scrap everything, go on this diet, but a diet is only as good if you actually follow it. So it has to be sustainable in the long run. We mentioned, you know, the 3 to 5% weight loss, seeing a positive improvement. We also see, you know, in that upward range of weight loss around the 7 to 10%, but that has to be in a sustainable manner. If you lose it, you know, in a few weeks and then you gain it back, you're not benefiting at all. So really what we're trying to say is make small steps and small adjustments to your diet to benefit. That's something that is in your control. And that's really what I would like to focus on. So I'll turn it back over to you, Dr. Takei, to you know, open up the floor for questions and other discussion points from Dr. Patel and Terry.
Great. Thank you so much. There are a couple of questions that have already entered into the chat box, so I will start with those. And just as a reminder, if there are any additional questions that you may have, you can either put them in the chat box, and we'll be checking the raise hand thing, so you can also do that. But the first question comes from Mrs. Eileen Wagner, and she said, as a liver recipient, and I will have to ask a clarifying question about that liver recipient, how long before I can develop NASH? And if Mrs. Wagner's on the line, do you mean, are you a liver transplant recipient? Yep. I see you raised your hand. See. Well, maybe we can just.
There we go. Can you hear me now?
Yes, I can hear you. Thank you.
Yeah. So I'm 2.5 years out, or almost 3 years out from a liver transplant, and I've really, the medicine, honest to God, it makes me just want to eat sugar constantly. But I have been eating like regular oats, you know, from oatmeal. But how long after you get your new liver does it take? I mean, I have to go on a diet. I've gained so much weight. The first year I gained nothing. I was like lovely. But it's really bad now. I mean, it's out of control. So I do have to go on a diet. I do smoothies with spinach. That's about the only greens I ever get. But again, I use fruit also. So, but how long after you have a transplant? I mean, how long does it take to get NASH?
That's a really good question, Eileen. And I think it's something that we talk to liver recipients about quite frequently, is that disease can reoccur in the transplanted liver. And so it reoccurs similarly to how it occurred in your native liver. So, you know, NASH is not a fast-moving disease for most people. Once you are diagnosed with NASH, it takes on average about 5 to 7 years to move from stage to stage of scarring. So there are 4 stages of scarring, cirrhosis being stage 4. So no scarring in your liver is stage 0. So it's really to move forward to recurrent cirrhosis in a transplanted liver, it does take time. It's not a fast process. So when you start to notice the weight gain, or you start to notice, metabolic syndrome developing, or you develop prediabetes or diabetes, it's really important to act early, because the earlier you act, the more benefit you can have in your transplanted liver.
Great. Thank you. And then thank you, Dr.
Sorry, I was going to jump in on the smoothie comment. I mean, it's great that you're consuming some fruits, and hopefully if they're in your whole form when you blend them, just being careful how much juice you're adding, because you're removing the fiber. And when you remove that fiber, it's not, you're getting that fructose, and that fructose is going straight to the liver. So we need to make sure that there's fiber in there. In your smoothie, we don't want to look at nutrition dichotomously, like I either ate healthy or I didn't. There's a spectrum. So it's great you're doing smoothies. It would be best if we ate the fruit whole, if we ate the spinach whole. One of the main reasons for this is the portion. I had a smoothie this morning, and I'm going to be honest. I drank a very large smoothie because it was good and I wasn't paying attention. I wasn't being mindful of the portion amount that I was consuming. So really being aware of how much you're ingesting at a given time too, splitting that up so you're not ingesting so many carbohydrates, and if they're processed right in that initial shock. And I hope that kind of helps answer that question. The oats is a great thing because, you're having the fiber, but just remembering to balance out your carbohydrates with other foods as well. So if you're having your oats, can you add in, I see almond milk in the chat box, or some dairy milk, or some, another protein or a healthy fat, so that it does slow the absorption of the carbohydrate into your bloodstream.
And Dr. McWhorter, could you speak to she alluded to cravings of sugar, yep, and how she may be able to manage that?
Yeah, I don't know if that's related to medication. That's definitely not my area of expertise, but cravings are real. And that's one of the reasons why I suggest not having cheat days. People oftentimes have this conception that I just have one day and just go all out and do whatever I want. It's better to, if you can, and I know everyone's different, Terry might feel different as a patient too, to have a little bit and set that aside and portion it so that you're allowing yourself some joy. That's a big thing that I talked about in the beginning, is diets are punishment. And if you continue to think of your health in a way of punishment, it's not sustainable. So how can you eat a way that you find joy and enjoyment out of for the, hopefully the many more years of your life, and you're able to still have a functional, good meal? That means you got to focus on the portion control, and you got to be aware of what you're eating. Don't eat in front of a screen. If you're eating right now, stop, pay attention to your food. Have a conversation, be mindful of what you're eating, and really focus on the beautiful flavors of the food that you like. And that would be my key answer to avoiding or focusing in on the sweet guilt treasures, all those, cravings, etc.
Okay, one of the things as a patient that I had to do was to get rid of the word diet and actually look at lifestyle. So I think we have been surrounded by the word diet. I mean, diet was definitely in my vocabulary as even as a 10-year-old, because my aunt was always on a diet. But if we look at lifestyle, it's I'm eating to live, not living to eat, and that is that's so important. I do celebrate, but it is portion control. It is going ahead and making sure, but not feeling guilty afterwards. So is a couple of bites of something that's good is okay. This weekend is my birthday. I get to celebrate it on Saturday with my family, and I will have a little bite of some good stuff, but it's not going to stay in the house for me to be tempted later on. And so I think that's also the other thing is don't set yourself up for failure. Don't go down the aisles where you're going to fail. Just something that I do.
Yeah, and don't lie to yourself. I mean, be honest with yourself. You're only hurting yourself if you lie and say, "Oh, I'm just gonna have one bite out of this container." I like Melanie's comment, "Don't eat out of the bag," because again, there's been studies that show if you give someone a bigger bag, they're going to eat more, and that's huge. That you got to fight yourself. Don't put the whole. If you're eating family style, don't put it on the table. Put it in a different room. If your place is large enough, my house is too small, so it's all in the same room. But if you have a large house, you have a dining room, and you're eating as a family, don't put the second servings on the table. Portion it out where you have to get up. You make a conscious decision to go into the next room. Don't put the rolls on the table. It's a lot of these little things that can really make a big change long term in your diet. And that's, it sounds, like, oh, that's too good to be true. But some of these small shifts can really add up in the long run.
Thank you. And I'm going to open this question up just to the group as well, since we are talking about lifestyle modifications and dietary modifications. What, I guess, is the success rate that you all, or how do you counsel patients or people that you're with about incorporating their family and their other structure when we're talking about how to manage, making these lifestyle changes? Is it just focused on them, or how are you incorporating their family or their family structures to help them to be successful?
I'm going to start off, and this is as a patient. And when I'm talking to members of the groups that I'm in, somebody asked which groups are those. It's CNU, which is Clean Nutrition University on Facebook, and then also Life with Liver Disease. So those are two of my groups that I have. I have a couple of other ones, but those are the two main ones. But when I'm talking to members, is one of the things as I tell them is that what they're doing, if they have small children, if they have grandchildren, is that they're being watched. And so the choices that they're making is going to convey down the line. It's important to go ahead and get your family a part of that. I have it easy, actually, is it's just my husband and I. And he adheres to whatever needs to happen with me. So, but that's just mine.
I would echo that. I think when talking to patients and talking to them about something like lifestyle change, it can be a big change. I mean, going from eating fast food, 4 times a week, or grabbing the easiest thing that you can, to really being conscious about what you're putting on your plate and into your body. It's a big shift. And so when you have family buy-in, and it's a family effort, I think success rates are better from my personal experience as a physician. But I also think that fatty liver itself, a lot of times exists in clusters of families. So if a patient has NASH and has advanced liver disease, the likelihood of their children having NASH is higher, and so it's really important for those patients to be, exemplifying the type of behaviors that their kids are going to want to follow as adults.
It's a really, really good point, because prevention is going to be much easier to accomplish than treating. And I think that's one of the key things is I saw, I think it was Wayne's comment up earlier, just about, how do you help get this information across, like, about doing this. We often, like, as providers, we often say, hey, you have fatty liver disease. Not to say anyone on this conversation is doing this, but this might have been something that happened to you, and it kind of happened to Terry. And then, you might hear something like, hey, you should do this change, go eat healthy, or don't eat fat, or no carbohydrates. But what does that actually mean when it comes down to, I'm at the grocery store, or I don't even prepare the meals in my home? My spouse or my grandmother or someone else does that for me. I don't have the ability, or I don't have a kitchen in my home. I don't live near a grocery store. I can't afford the foods that I think are healthy. And that's a lot where we really have to go back to the drawing board and provide some, I'll dip into what we do, which is a lot of these culinary based classes where we're, bringing in the food and saying, this is how you prepare these food items. And it's not that, you have to, you don't have to eat kale salads to be healthy. There's, collard greens is a dark leafy green just as much as kale is. And there's multiple varieties. I know Dr. Patil and I were talking about tortillas and how beautiful they are and how they can fit. But when you have a tortilla that's this big, instead of a smaller portion size, it makes a big difference when it's a very processed grain instead of being a whole grain. So, adjusting, your meal patterns, but having family buy-in, having community buy-in is going to be how success is. It takes a village to raise a child. It takes a village to make a big change in your health behaviors.
Thank you. And so I'm going to cluster some of these questions because I think they're all getting to the same point. There are some questions about the use of teas, green teas, specifically from Japan, monk fruit, sweet and low, I see in the chat. So could you all speak to that? And I think it would be helpful to speak to culturally relevant things that people may be using that could or don't have any benefit.
I will. Oh, go ahead, Terry. Would you like to speak?
Okay. Here's what I also tell my members: don't major on the minor things. And so focusing on one aspect of what you're eating, what you're consuming with all the different things, what might work for one person won't work for another. I also have diabetes. So there's certain things that will spike my sugar. I don't want to spike my sugar. So it is something. I'm not going to touch the tea question. I'll leave that for Dr. Patil to answer the green tea question. I stay away from juices. I go towards whole fruits and enjoy those. So hopefully that answers that. I know, like I said, don't major on the minors.
I would say that this is a common question that I get from patients. So as soon as they find out that they have fatty liver or they have abnormal liver tests, the first thing they want to know is, what pill can I take? What herbal supplement can I take? What tea might help? And I can tell you that the majority of the time, it's not a good decision to try to embark on a liver cleanse or some quick fix that you find on the internet. A lot of things that actually patients get exposed to are not well vetted and can actually cause more harm in the liver than good. There is such a thing as drug or medication-induced liver injury, and there's definitely the possibility that you could be risking your liver health by trying to buy a quick fix online. But if it's a cultural thing, and sometimes folks will say, well, what about ginger, or what about turmeric? Those types of things are okay, but there's no direct benefit to the liver. So I think it's a case by case basis.
Yeah, I can add a little bit here. Oftentimes we're like, I need antioxidants. What contains antioxidants? Vegetables and fruits. It has one of the highest amounts of antioxidants is the red cabbage or the purple cabbage. And it's like $1 for a ginormous one, and it'll last 2 months in the fridge. So you don't have to go and spend a ton of money to get some quality foods in your diet. Another thing is I've seen some questions like, sugar-free drinks. Is that something? Well, you got to look at what's your starting point. Are you drinking 5 or 6 sugar sweetened beverages? Then yeah, that's a great transition. Would we recommend, to drink a ton of, sugar-free drinks? No, because the literature is still out there as to whether it could or could not impact. Right now we don't think it has a massive impact, but that could change. So don't overconsume things like this, but if it helps you transition into a better dietary pattern, then that's a good step. I wouldn't encourage, kids to be drinking sugar sweetened beverages. And if you have a juice, I saw somebody's comment that doing them in small portions, that's a good way to do it. Do it in smaller portions, treat it as a treat, because as Terry mentioned, when you're drinking juice, you're taking out the fiber and then you're basically drinking fructose syrup. I mean, it's not syrup form, it's more liquid, but Another thing you can do is kind of transition down. You can have a sparkling water with some juice mixed in, so it's still sweet and you get that, that taste. Because a lot of us, if you've drank sugar sweetened beverages for, years on end, drinking water is boring. You need some fizz, you need some life to it. So a transition down will help your taste buds adjust, and that can help it be more sustainable.
Thank you. Shatal Patel in the chat said, what are typically the first symptoms that that people developing NASH tend to experience? And Dr. Patel, maybe you can speak to this.
That's a good question. I didn't touch on that when I was describing fatty liver. And, the majority of patients will not have symptoms. And I think that's what makes NASH so dangerous. It is, for the most part, I would say 80% of patients don't have symptoms. But if you do have symptoms, then the two most common symptoms are fatigue. So just generalized, generally not feeling like you have a lot of energy. And that's just really non-specific as well for your doctor. So if you tell your doctor I'm fatigued, they'll go down, this rabbit hole of, what could be all the causes of why you're tired. And then the second most common symptom would be pain in your abdomen, on the right upper portion of your abdomen, which is where your liver sits. And so people do feel, a specific type of pain, like a fullness in their abdomen. And when they make lifestyle changes, that pain goes away. So those would be probably the most common symptoms.
And I have a couple more questions for you, Dr. Patel. So there was a good question that came about the FibroScan, which you mentioned earlier in your talk. And the question is, do you, in your opinion, feel that individuals who get a FibroScan, should they be getting it on a regular interval, like we do for some of those things like mammograms or colonoscopy screens that kind of have an age-based a metric of when you should be getting those, in your opinion?
So I have a very strong opinion about when you should get a FibroScan. I wish that every general practitioner had a FibroScan in their office. That would be the ideal scenario. However, that's not reality. And so what I recommend is that if you are diabetic, that you are searching for, number one, an answer as to whether or not you have fatty liver, because 80% of patients with diabetes do have fatty liver, and that you're getting your disease risk stratified, right? So are you somebody who has a high risk for NASH or not? There are no guidelines currently in our medical system that, tell primary care physicians or those who treat diabetics to actually screen with a FibroScan. What they are told in the guidelines is to, if they think you're high risk for fatty liver, to do liver tests through your blood, like blood work, and to do a general, just an ultrasound of your belly. So because there are no guidelines, it's hard for a massive change to happen in the way that we're approaching NASH, but we're getting there. And I think Terry probably works with several of these groups, that we're incrementally, kind of moving the needle to change the way that we screen for this disease.
And on that note, could you speak to Deanne Sneed's question about the accuracy of the FibroScan? She mentioned that she gets inconsistent scores from 2 up to 4. And so is MR elastography a better option?
Mm-hmm. Yeah, that's a really good question. So the FibroScan is really good. When we use the FibroScan, we use it to rule out significant disease. So it has a really good, what we call negative predictive value. If I do a FibroScan and I see that your liver is not very stiff, I have about 95% or higher certainty that you don't have scarring in your liver. However, on the positive end, it is not great. So it's, it's a test that is quite variable, and depending on where you carry your weight, if you have a lot of central belly fat, it can affect the results. There are other types of diseases that can affect the results, but high risk is high risk. So even if there's variability, if you're getting consistently high readings, then you should be getting further investigation of your liver. The MRI with elastography is a much more specific exam, and it's much more accurate in understanding your overall risk of scarring in your liver. However, it's really not available at a lot of centers. I mean, I work in the Rio Grande Valley, and I know for the entire population here of about 2 million people, there's one MRI that has the capability to do an MRI with elastography. So if you're at a big academic center or you're like in a big city, great, you might have access to it and your doctor can order it, but most people don't have access to that imaging modality, if that answers the question. It's a better test though.
Great. And the next question, I'd like to open it up to everyone. And this is from John Volpe. And can you all kind of speak to, I guess, the idea of why the seriousness or the emphasis on fatty liver is not stressed enough with providers? And why does it feel, I guess, that, we're not talking about NASH enough, or people don't know enough about this disease?
I can tell you is that since 2017, there's a lot more doctors that are more familiar with it. So there's a lot of awareness that's been built is through different organizations, through foundations, some of them I've worked with. And so I am amazed at the amount of awareness that has been built since then. But it also comes down to you as a patient, is you asking and saying, hey, is I suspect. So advocate for yourself and step out and ask that. One of the things is that I heard early on is that NASH is called the silent killer. And because it isn't seen, but I'm so glad that I had that surgery because it exposed it. And it also gave me a whole new passion, a whole new direction to be able to help others so that they don't go as far as I have. But has to start somewhere, and today it starts here.
I would just say from a medical perspective that when things aren't in guidelines, it's hard to really affect change. So I think once awareness of fatty liver is implemented into specific types of guidelines, particularly in diabetes, I think we'll see a bigger shift. But I also think that doctors maybe don't investigate fatty liver further because in their minds, they may say, well, okay, like you have fatty liver, but what am I going to do about it? Like, I don't have a drug to give you. There are no medications that are FDA approved yet to treat NASH. So, maybe that's why there's not a lot of discussion about it, because beyond a discussion about lifestyle change, they may not know what to do. So things will also be changing in that realm, because there's a lot of work being done in drug development right now for NASH as well. So the conversation may be very different in 5 years.
Getting a lot in the chat about, I'm sorry, Dr. McWhorter, did you want to say something?
I just saw the comment about weight, and I thought we could discuss that.
Yes.
I completely agree with you, Melanie. It's weight often is just, it's a personal decision, and it's all about, your choice to just lose weight. If you just tried harder, then you would be successful. You're just non-compliant, blah, 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 blah. Not to say that that's every physician's communication or every dietitian's communication, but oftentimes people can get categorized and put in that way. And it's unfortunate because it's absolutely not true. We know that obesity is a very, very complex issue, and it's an issue that is systemic across the board. There's many factors that affect the reasons why someone might have weight, and weight might not be causing it in the first place. It can be associated, but doesn't necessarily have to be causing it. So looking more at, when Dr. Patil talked about lifestyle factors, well, are the behaviors that you can change, are you doing those? Like, are you eating a healthy dietary pattern? You might have higher weight, and that's actually not even reflective. Sometimes it is. I mean, that's a given, but focusing again on those behaviors that are in our control, getting physical activity, getting some good sleep, and then consuming a healthy dietary pattern overall.
Great, thank you. So Dr. Patel, Dr. Milton, and Dr. McWhorter, the holidays are coming up, and so people are going to be in their intimate, relation, their family, around friends. In the simplest of terms, how would you describe, or I guess educate people to describe or to talk about NASH? What kinds of words in the most simplest form would you use?
That's an interesting question. And basically is when you talk to your family about whether it's your diagnosis or a concern that you're seeing within is now, Dr. DK, is this having to do with you have been diagnosed and you're trying to tell your family, or are you just having a conversation?
I think we can say both scenarios.
Okay. I'm going to go with definitely. There's not a lot I can control if I go to somebody else's house to be able to eat, first of all. So it's bringing my own food. I bring the healthy stuff that I like, that I know that has been made by my hand and isn't processed. But having those conversations, it's not just a one-time thing. It's over a period of time. For me, as I set up a Facebook group that tracks, and I give them updates on my test and different things so that no one in the family and some of my close friends all know what's going on. I'm pre-transplant, so I'm now on the transplant list. And so they know what those means. As I talk about the terms, is I encourage them to get screened. And as my kids probably roll their eyes every time I ask them when they go to the doctor, is, so how did your testing go? Okay, so they did a liver function test. Did they do another kind of test? Are they going to do, so here's mom, is I'm asking those questions. And it is important. To say the word NASH is, a lot of people disconnect. Non-alcoholic steatohepatitis. They click onto the non-alcoholic, but the rest of it they don't know. So as I just say, an advanced form of fatty liver is what I have. And that's the easiest way for me to be able to explain it to them.
I would agree with that, when I explain what NASH is, I would say it's fatty liver, but it's more aggressive. And there's a big difference between having simple fatty liver and NASH, because NASH can lead to dramatic problems in your liver, like cirrhosis and like liver cancer. So, Terry is a perfect example of somebody who can speak to that. It's not a benign condition. So it's just, I think a lot of folks, when they talk to their family, there's a big misconception that having chronic liver disease or having cirrhosis, that you have to be drinking heavily, or that you have to be, the history of alcoholism. And that's in fact not the case at all. We know that in the transplant world that NASH is fast becoming the #1 cause for the need for liver transplantation, surpassing hepatitis C and alcohol-induced liver disease. So it's just, I would say, when you're talking to your family, say, look, fatty liver is really common, and know your status. Like, get your liver checked. It's really important, because how healthy your liver is it's symbolic of how healthy you are. So yeah, know your status, I would say.
And right after you tell that to them, I would cook them some roasted vegetables and say, try these. These are really good. And that's a way to introduce the lifestyle change at the same time, not to make light, but in all seriousness, if you're around the holidays, I liked what Terry said is, checking and bringing the dish that you like, that is better for you. So you have something to eat. Plan ahead at that meal table. When it's a big buffet, you don't need everything. You need, if you want to try everything, well, then make sure it's small portions. You don't have to clean your plate. That's a big misnomer that we taught our kids growing up. It's something I learned is clean your plate. Clean your plate. It's a sunk cost. It's already been spent. So you can save it the next day. You can have another meal. Don't keep that up. Use smaller plates if you have to. But in all seriousness, try roasting vegetables. It's one of the easiest ways to add a lot of flavor to your plate. Coming from a family that doesn't like eating healthy, it's what I do every holiday I'm home. It's what I always prepare, and usually that is always eaten. So there's certain ways you can help make the transition to healthier eating, and arguing about the health of it is not always the best way. It's about through flavor and enjoyment.
Thank you. And this has been such a great conversation. All of the questions were so relevant. So thank you all. Before we wrap up, I have one final question for all of the panelists. I would ask you all to answer, what is your one liver healthy food that you all enjoy?
For me, is I love baked chicken with roasted vegetables. Just there's different kinds. I actually enjoy snapping my own green beans. There's different spices I can use on them, and I am a spice girl to the max this time.
I'll jump in because you said roasted vegetables, and I don't know, I'm on that too. I really like roasted sweet potatoes. They have a good amount of fiber. They're real sweet, so I like making them spicy, using a lot of spices. And then if I'm feeling a little, like I have extra time, I'll make a sauce to go with it. Something like we call it a chimichurri, but we take a lot of herbs and then we blend it with fresh oranges. So it's a chunky sauce, and you put it on the really spicy sweet potato, and it just really comes together well. So you got a lot of fat, you got a lot of so the fiber, and you got the carbohydrates. So it kind of really comes together as a delicious deal.
I would say, in general, I've been trying to be more healthy recently. So, cutting back on the carbohydrates, it's hard, the processed foods. But I would say just, preparing a meal that's nutritious, that makes me feel good, that's light, anything, with a good vegetable, a nice piece of lean meat. I love salmon. I've been eating a lot of fish. And salads have become my friend. I know that maybe they can be boring to some people, but I really like them.
They can be good. They can be.
They
You
can
just
be
got to
really
learn.
good.
So
I would
always.
just, yeah, I would just say, anything healthy that you can eat, your liver is going to thank you, for sure.
Great. Well, thank you, Dr. McWhorter. Thank you, Dr. Patel. Thank you, Mrs. Milton, for your expert opinions, providing all of the information that you did. In the chat, there's actually their information where you can find them. I think we can have it available to you. I saw some questions about where they can, join some groups or find out some more information. So we can maybe have that available for all of you who joined today. Thank you again, once again, to the Texas, for the Health Museum, I'm sorry, for providing this platform for us. And just as a side note, the Texas Liver Foundation, we are doing monthly conversations and series every month focusing on a different liver topic. So come back again next month and the month following that for the rest of the year and into 2022. And we would love to see you all. Thank you.
All right. Thank everybody for coming. If you're still here, it was our sincere pleasure to have you all here with us today. And please come visit the Health Museum if you're curious about health, medical science, and the human body. We have a new exhibit called Beautiful Minds. It's about dyslexia and the creative advantage. And actually this weekend, on Saturday, October 16th, we're opening our newest portion of an exhibit, which is a gallery by Joni Zavitsanos. And it's called Living Icons. It's a commemorative of the victims of Houston's COVID-19 pandemic. So it's hundreds of pictures of people that we've lost. So it's very powerful, it's very poignant, and it opens to the public this weekend. So, and we look forward to next month and joining you guys again.